Hello, my name's Lindsay Bell. I'm one of the senior managers in the primary care team at the ICB in Leeds. I'm going to be presenting today on the winter vaccinations update for this year 25-26 and this is going to be presented in September's target training session. This presentation was originally developed by myself and Sarah O'Donnell, who was the strategic lead for general practice nursing and is also a Queen's nurse and independent trainer as well. And then we've updated this presentation for this year's winter vaccination campaign. So I'll give you an overview of all the key elements. The slides will be made available, so if there's any details on there, you can look through those at your own leisure. And if you have any questions about this year's winter vaccination campaign, please feel free to contact either myself or Jill Ramsden, who's now taken over from Sarah as professional lead for general practice nursing. So today's update will cover several areas. We're going to look at the uptake achievement for the previous year, the eligible cohorts for this year's campaign, information on vaccination supply, the support that's available around different delivery models, staff vaccination information, key areas of focus that we want providers to look at for this year's campaign, and also the support that's available to both practices and PCNs. So this slide shows you some of the key uptake outcomes for 24-25. Uptake was good, but there were still areas of improvement and some areas that we need to work on for this year for particular key cohorts. So you can see from the slide there that we did better than last year on 2 and 3 year olds and pregnant women, but we had lower uptake in over 65s for flu. That is a further decrease from last year, so we're now just over 4% down from where we were 2 years ago. And we had lower uptake for care home residents and also for care home staff as well, so that's one of the areas that we'd like you to focus on. Overall, the national target for COVID uptake is still 54%. So eligible cohorts for this year's flu campaign are similar to those in previous years, and the timing of the campaign is also similar to last year. So we'll be starting with children, 2 and 3 year olds and children at risk under 18 from the 1st of September, along with pregnant women. And then from the 1st of October, the remaining adult cohorts will come on board, as well as the COVID vaccination cohorts. The flu cohorts for this year will remain as per previous years. So clinical at risk, 2 and 3 year olds, primary school and secondary school aged children, patients with learning disabilities, patients residing in care homes, housebound patients, carers and frontline social care workers that don't have access to occupational health services. The cohorts for COVID vaccination this year are slightly reduced from previous years. So this year we'll be vaccinating patients over 75 years old, patients in care homes, and also any patients aged 6 months to under 74 who are deemed to be immunocompromised as per the Green Book. In addition to general practice, community pharmacy are also able to opt in to vaccinate 2 and 3 year olds this year. So that's a change from previous years, and they are able to start vaccinating those children from the 1st of October. So we encourage providers to try and get their children clinics done in September as early as possible, and then there's additional access available for parents throughout the remainder of the campaign. Practices are also reminded that they are responsible for vaccinating school-aged children if they fall into one of the clinical risk groups as well. Providers are reminded that the Joint Committee on Vaccination and Immunisation didn't recommend COVID vaccination for patients in clinical risk groups other than immunocompromised patients. So that's a change from last year. It also didn't recommend COVID vaccination for frontline health and care workers outside of their employer's normal occupational health service. So trusts and also general practice providers should be putting in place their own vaccination programs for staff. We do advise as well, general practice, if you do have staff that fall into one of the clinical risk groups or in an age category, that you do advise them to go to their own registered GP or community pharmacy to receive the flu or COVID vaccination. This year again, there are also several other vaccinations that people can get at the same time, and where possible, co-administration of vaccinations should be utilised. However, It's not recommended that flu vaccination be routinely given with the new RSV vaccination for older people on the same appointment at the same day. The reason for that is that it can reduce the effectiveness of the flu vaccine. For COVID, it's fine to give at the same time as RSV, which is a slight change from last year. You can give flu with RSV, though, if it is thought that the patient will not return for a future appointment, so it's better to get vaccinated than not vaccinated. The RSV can be given at the same time as other vaccinations for pregnant people, including pertussis and flu and COVID. This year's flu vaccination programme, providers should ensure that they order alternative vaccines for adults based on the 25-26 vaccine recommendations from the Joint Committee on Vaccination and Immunisation, and information on what's available is online. For adults over 65 years old, providers are recommended to use the ATIV vaccine from Seqirus or the Effluelda high-dose TIV vaccination or Supemtec recombinant vaccinations from Sanofi. The cell-based trivalent influenza vaccination can also be considered when all other vaccination supplies have been exhausted. For adults aged 18 to 64 years, the cell-based trivalent influenza vaccine from Seqirus or the Supemtec recombinant vaccination from Sanofi should be used. Patients over 50 years old can use the ATIV vaccination, and for patients over 60 years old, you can also use the high-dose TIV vaccine as well. The egg-grown trivalent influenza vaccine from Sanofi or Viatris can also be considered when every attempt to use the other vaccine supplies has been exhausted. This year, due to a change in the vaccine strains, we'll be using trivalent vaccinations as opposed to quadrivalent vaccinations from last year. For adults who have severe needle phobia, such as those with learning disabilities or autism, the Fluens trivalent live attenuated vaccine nasal spray can be used as an alternative for those patients. For children aged 6 months to 17 years old, the Fluens trivalent live attenuated nasal spray vaccination should be used. And practices should be aware of any patients who may decline this vaccination due to cultural or religious reasons. If the patient of an eligible child declines the nasal spray because of the porcine gelatin content, they can request an alternative injectable vaccine. These are available to order through Inform, and you should use a cell-based vaccination instead. To support patients who may have cultural or religious objections to the nasal spray vaccination, there is further information available from the Muslim Council of Britain, the British Islamic Medical Association, and also the Jewish Medical Association. A reminder to GP practices that you funded through the item of service fee at £10.06 per dose administered for flu vaccination, and practices can also claim back the cost of supplying the flu vaccination where this has been purchased directly by them through the NHS Business Services Authority's personally administered medication. For the COVID vaccination national programme, we'll be using the Pfizer Comirnaty mRNA vaccine. For people under the age of 12, the Pfizer Comirnaty vaccine should be used in a dose appropriate for the age of the child, and that's shown on the slide. It's not clear at the time of this presentation whether there will be any services available for non-mRNA vaccines for patients where mRNA products are considered not clinically suitable. When this is confirmed, information will be shared with providers. COVID-19 vaccination is now available privately for anyone who is not eligible for the national vaccination campaign. In addition to flu and COVID, there are also other vaccinations that are available to people. The new national vaccination programme for respiratory syncytial virus, RSV, which started last September and uses the Abruzzo vaccine from Pfizer. This will be continuing throughout the year, so everybody turning 75 years or more from the 1st of September 2024 onwards will be eligible to receive this vaccine, and will remain eligible until they turn 80 years old. So there may be additional patients to vaccinate this year. Patients can still get this vaccine up until the day before they turn 80. It's not recommended that the RSV vaccination be routinely co-administered with flu vaccination, but can be delivered with COVID vaccination, shingles and pneumococcal vaccination for older people. In addition to older people, people who are 28 weeks pregnant and over are also eligible for the RSV vaccination. RSV vaccine can be co-administered with the pertussis vaccination. However, people who are pregnant and eligible for the pertussis vaccination from 16 weeks should not delay to wait to get both vaccinations together. GPs will need to check their patient database throughout the duration of the winter vaccination programme to make sure that patients are accurately identified as women become pregnant and throughout the season, and then also make opportunistic offers to patients when possible. Other vaccinations that are available for older people include pneumococcal vaccination and shingles vaccination. Pneumococcal vaccination is available for anybody over the age of 65 years old and those in a clinical risk group defined by the Green Book. We're also recommending, again as per previous years, that patients with a learning disability be offered pneumococcal vaccination. This decision to vaccinate these people is supported by the Right Care programme to reduce the impact of aspiration pneumonia. The shingles vaccination is also available to patients between the age of 70 and 79 years old. From September 2023, people turning 65 each year were also eligible to receive this vaccination. In addition, the change to the programme from September the 1st onwards has expanded the cohort for patients who are severely immunocompromised, increasing it from patients from 50 years old to now patients who are over 18. And the shingles vaccination campaign has the 2-dose Shingrix vaccination, which should be used as the main vaccination offered. Both pneumococcal and shingles vaccination can be given at the same time as flu, COVID and the new RSV vaccine. Points to note for providers this year. Please ensure that practice staff are familiar with the MHRA guidance on mutual aid and sharing of vaccination supplies. There are different rules for sharing flu and COVID vaccines versus other vaccinations. There are also options to use PGD's patient group directions across a PCN, which will allow you then to offer larger scale clinics to deliver to multiple practice populations. Those larger scale clinics can also be implemented using the variation to the PCN network contract, specifically for vaccination services, as well as the collaboration agreements for both flu and COVID, which will allow providers to deliver larger scale clinics to all patients registered at all practices within your PCN. The NHS Business Services Authority has also produced guidance on how to claim PPA reimbursements and item of service fees for COVID vaccinations. There is also guidance for practices on how to claim item of service fee alongside the CQRS guidance for claiming vaccination payments for both lead practices and also individual practices. These should be reviewed by providers to ensure that payments can be claimed in a timely manner. An increase in vaccination stock can result in an increase in cold chain incidents, so practices should ensure that all staff are trained in cold chain procedures from receiving vaccinations delivery stage to unpacking, storing and then also stock handling as well. If they handle stock from reception staff receiving deliveries right through to staff administering vaccinations and everyone in between, they should be trained and knowledgeable about cold chain and cold chain procedures. Practices should check stock levels on a weekly basis, both as a practice and as a PCN, to make sure that vaccinations are not expiring in fridges. Practices should do weekly and monthly fridge audits to make sure that stock is correctly stored, rotated and that temperature monitoring is done. These are some of the main reasons that we have vaccination incidents each year throughout the campaign. Ensure that expiry dates are checked, as this is also one of the main causes for vaccination incidents and wastage. Try to keep supply wastage to a minimum, use mutual aid where available, and if possible, if you have any surplus, share that with other practices in accordance with the guidelines. Only order the minimum required for a couple of weeks ahead and ensure that you've checked your fridge supplies to make sure everything is stored correctly. Stock for all of the national vaccination programmes, except for flu and COVID, can be ordered using the Inform website. So points for practices on delivery models. Practices and PCNs should work together to deliver vaccination access through the most efficient and effective model for their particular population. Use the learning that you've gained from previous campaigns around what works well in your particular area and for your particular cohorts of patients. Co-administer vaccinations where appropriate and when you think there is a high risk of someone not returning for further appointments. Look at tailoring some of the clinics to meet the specific needs of particular groups of patients within your population. This might include themed children parties, reasonable adjustment clinics for patients who have additional support needs or require extra time. There are some good examples of supporting these patients, including making walkthrough videos showing what happens during a clinic, having quiet clinics for patients who get overstimulated, and other adjustments. Other options might include focusing on patients with sensory challenges, so looking at quiet clinics where there are less people in the waiting area, running intergenerational clinics where family groups such as grandparents, parents and children and carers can all come together so that people don't have to arrange carers or childcare responsibilities. If you need additional support in reaching out to particular groups of patients such as those with learning disabilities, the health facilitation team at LYPFT can support you with different approaches, and they have lots of resources available for providers. There's also a wealth of easy read information available through LYPFT on their website, and this can also be used for people whose first language isn't English and also have a low level of literacy. Providers should offer clinics at a range of days and times. Use the Leeds City Council's 5A Foundation of Accessibility to review the service delivery models that you are offering. The 5A's include affordability, considerations about costs being made and how that might impact on people. Things like, do they require time off work? Will they need childcare? Do they have caring responsibilities? And are they able to travel to the service? Availability. Do people have different options to access the service depending on their need? How are people's needs being identified and responded to? Are the services timely and available at different times of the day and week? Is there enough capacity to meet demand? Accessibility. Is the service friendly and accessible to all? Is it easy for everyone to understand how to access the service? And is this information available to them in a format that they can understand and gain access to? Have you as a practice met the accessibility information standards in communicating this to patients? Have you considered staff training on accessibility and communication? And have you reviewed the physical environment to ensure that this is accessible to the most number of patients? What solutions are available to patients to address digital or language challenges? The fourth A is acceptability. Is the service that you are delivering acceptable regardless of patients' characteristics? Are communities' health and cultural and social beliefs considered? If a community has a particular social belief or cultural belief, can this be considered when delivering services so that clinics might be adapted to better suit that particular community? Is the impact of this clinic recognised on particular communities? If you're delivering services at a particular day, for example on a Friday, does that interfere with particular communities' ability to practice their religious beliefs? What evidence do you have that the service is equitable to all? Do you engage patient feedback on how you're delivering services and use this then to improve and adapt as you go forwards? How are any changes to the services communicated to people? Do you provide information on your practice website about how you will be delivering winter vaccinations, when information will be available, how patients can make appointments through different methods, and what help is available to them if they are struggling with particular access models? And the last A is appropriateness. So is the service shaped by the population's needs? Is the service appropriate for different communities within your patient population? Have you had feedback from those populations and taken on board any comments that they have made about how easy or difficult it is to access the winter vaccination services that you are providing? Providers should try and utilise technology where appropriate to maximise uptake and also make access as easy and quick as possible. This might include sending out SMS texts with self-booking links to allow patients to book quickly and online. It may be making vaccination appointments available to book through other online methods such as the NHS app. Are you working collaboratively with other partners such as community pharmacy and also third sector organisations? Ensure that there are simple and easy ways for other providers to arrange appointments for patients. These ways might include allowing community nursing or midwifery teams to send clinical tasks to the practice to request a self-booking link on behalf of patients. It can also include things like a dedicated direct dial number for patients and other healthcare professionals to call into perhaps the admin team directly to make appointments for vaccinations without having to utilise the practice's normal queuing system. Providers should maximise the use of the staff available to vaccinate. Patient group directions and the national protocol will also be available again this year. The national protocol allows for the preparation, administration of the vaccination and record keeping to be undertaken by registered or non-registered persons who are appropriately trained, competent and working under supervision. The clinical assessment and consent under the national protocol must only be undertaken by a prescriber or a specified registered health professional. For staff vaccination, all frontline healthcare workers, including clinical and non-clinical staff who have contact with patients, should be offered influenza and COVID vaccination to protect themselves and those that they care for. This should be provided by their employer as part of the organisation's occupational health policy to prevent transmission of infection. GP practices should not vaccinate their own staff unless as part of an occupational health service delivered under written instruction or patient-specific direction. GP practices should only vaccinate their own staff if they are not eligible under the National Vaccination Programme, and staff who are eligible should be advised to contact their own registered GP for vaccination. PCNs may also offer peer-to-peer vaccination services for non-eligible staff working in practices within their PCNs. Further information on staff vaccination can be found at the sps.nhs.uk, which is the website for specialist pharmacy services. This will provide the details of how practices can undertake vaccination through peer-to-peer vaccination or written instruction or patient-specific direction. Social care staff are also included in vaccination programmes, and those working in care homes should be prioritised. This year there are a number of key focus areas which we would like providers to address. The campaign includes people who are under 65-year-old in a clinical risk group. Providers should focus particularly on those who have respiratory diseases where they may be at higher risk of hospitalisation if they become unwell. People who are in very high risk groups such as those over 75 years old, particularly if they are frail or have a condition which increases their clinical risk, and immunocompromised people. Younger people and children at greater risk, this may include 2 and 3 year olds and also children under 18 who are in a clinical risk group. Particular attention should be paid to any children from a faith or cultural background that have complex care needs and may be hesitant to take up the vaccine due to the porcine gelatin content. To support practices for this year's winter vaccination campaign, there are a number of resources and training sessions available. Immunisation training for new vaccinators and also annual updates is available through the West Yorkshire Primary Care Workforce and Training Hub. If you are unable to book a training session, please contact the West Yorkshire Training Hub at the email address on this slide, and they can arrange for additional capacity to be put on. Training is also available through the different vaccine manufacturer sites, and there are also e-learning sessions available through e-learning for health. However, it is recommended attending one of the training sessions through the Training Hub. To support practices in communication with patients with learning disabilities, low levels of literacy, and also those who do not speak English as their first language, the health facilitation team at LYPFT have produced a number of easy read resources. These are available through their Get Checked Out website and cover lots of different topics. There is additional information, letters, leaflets available in multiple languages, and also other literature available via the vaccine programme pages on gov.uk. Each year the national team will release vaccination campaign materials, and these are usually available to download, print and order through the Department of Health and Social Care Campaign Resource Centre. There are also campaign materials available through the UK Health Security Agency Health Publications website. These resources support you to communicate with your patients and can be used on your practice website and in social media channels. In addition to the national materials, the Public Health Resource Centre in Leeds also holds lots of different leaflets and some vaccinations and wider topics, and can support practices in accessing additional materials. A link to a short video to showcase the Public Health Resource Centre has been included in the slides. We hope you found this update informative and interesting. If you have any questions about this year's winter vaccination campaign, or you feel that you need additional support, please feel free to contact either myself, the primary care team at the ICB, or Jill Ramsden, professional lead for general practice nursing. Thank you for your time today. There's an evaluation code following this presentation if you'd like to give your feedback on today's information.